9:40 on the clock. A very good morning to you and welcome once again to the show. Well, addressing all our concerns, we are joined by Dr. Rupa Bakthavatchalu, a specialist pediatrician, NMC Medical Center, Safari Mall, Sharjah. Dr. Rupa, welcome to the show.
Yes, hello, I'm Dr. Rupa. I'm very glad to be here and thanks for this excellent opportunity.
Well, thank you, Dr. Rupa, for taking time out and coming in onto the show as well. Okay, first things first, I loved how Dr. Rupa came into the studio and said, "This is my first time, please be easy." In fact, I am more nervous asking you questions, Dr. Rupa.
Yeah.
So as a parent, it is I think we have so many questions that weigh us down, right? And it is very difficult to get answers, especially if you don't really know what to do with an infant. I'm sure you have a lot of parents coming to you, asking you several questions. And we'll start off the show with a basic question. What are the precautionary measures as a parent I need to take, say, regarding food, drinking water, and hygiene during travel? We know that the travel season is around the corner. So what should I do?
Yeah, the parents should carry a boiled and cooled water with the intact seal while traveling with the kid. And they should carry their favorite snacks with them because hunger makes the kid cranky and uncomfortable. And the parents should say a big no to the street foods. Especially the street foods is so unhygienic and contaminated and will cause some infections to the baby especially. And hand washing properly with the soap and water, and if hand washing is not available, use sanitizers.
Okay, so this is all very important. Now, is it only for, say, a child who's 3 years of age, 4 years of age, or also for toddlers? And very, I'm talking about infants, like as small as 2 months and 3 months. Is traveling at that age also safe?
Yes, because they need to take care of the baby in from the hometown with their grandparents, right? So they used to travel with a small baby. So that time we have to be more precaution and try to exclusively breastfeed the baby up to 6 months and avoid bottle feeding. Okay, and preferably take an aisle seat. The aisle, it is comfortable for the mother as well as baby for feeding. So preferably take an aisle seats, and we can request a bassinet also for infants up to 18 months of age.
Right.
And we need to carry the essential medications.
Like what medications? Fever medications. I'm talking about Adol and all of these medications.
Exactly. Fever medications, vomiting medications, and the colic medications because they used to get stomach upset. So colic medications we need to carry, and basic cough and cold medications, and the basic ORS powder with sachets we need to carry, and the itching lotion, antiseptic cream, sunscreens, and mosquito repellents also it's needed while traveling.
Right. Dr. Rupa, you mentioned colic over here, and this is also, as a parent, I didn't know what colic is. So what is colic? Can you help me understand? And why do children have colic? I mean, is it, part of their system growing up, or how do I get rid of it? Because the screams are so loud that my ears start to hurt that bad.
So colic is something could be a normal finding in a child. So mostly it will be around the belly button or above or below the belly button. So it could be of no cause. But before that, if the child develops colic during the night time, the child crying incessantly for more than 30 minutes with the colicky, if the child develops any vomiting or loose stools with the colicky pain, then we need to consult a doctor. Otherwise, the colicky pain is something functional in some children.
Okay. And, we spoke to you about medicines. We spoke to you about the precautions that I need to bear in mind before traveling. But are there any vaccinations that I need to give my child?
Yes, the parents should complete the routine vaccination 72 hours prior to the travel. And the family should have the knowledge about the special vaccines need to be carried for certain destinations like influenza, meningococcal, pneumococcal, hepatitis A. So these special vaccines need to be carried for certain destination. For that, we need to consult with a pediatric doctor.
Right. Now tell me something, doctor. Say, for instance, my son is 6 months. Now tell me something, doctor. Say, for instance, my son is 6 months of age, okay? I've given him his vaccinations over here, but there are a few medicines that I feel, if I go back home to India, maybe I can give it there. Vaccinations in different country are different, or how does it really work?
Mostly they will be same. So some vaccines may be missed in India, some vaccines may given here extra. So we need to adjust. The pediatrician should adjust both the vaccines so that the child receive all the essential vaccines for that age.
Right. And if I'm a new mom and I'm traveling with my child, what are the precautions that I need to take? I mean, of course, it's impossible for me. If it's a long haul flight, maybe I can look at breastfeeding, but every time it won't be possible, right? It could also get very uncomfortable. How can I prepare myself?
Yeah, try to exclusively breastfeed the baby up to 6 months and try to avoid bottle feeds. So up to 6 months you can exclusively breastfeed. After 6 months you can carry some formula with you, and you must take plenty of nappies and wipes and essential medicines like paracetamol, colic drops with you. And Azel seat is preferred, as I mentioned earlier. Azel seat is preferred, and the bassinet cabin can be requested for infants up to 18 months of age.
Right. Dr. Rupa, also there is this, right? I mean, I suffered from this, and that's why it's a personal experience. Whilst some mothers, it's easy to lactate, it was very difficult for me to lactate, and that's why my son had to be kept on bottle feed, I think, at 3 months of age. Is that normal? Is that not normal? What happens if the mother can't lactate that much?
Yeah, I can understand this, but the separate breastfeeding rooms are available in the airports, and you can request any help from the hair hostess during the feeding, so that you can continue the exclusive breastfeeding all during the traveling time.
Okay. And how do you manage motion sickness, air pressure changes, and jet lags?
See, this is very common in some children, but not in all children. So, for the child with motion sickness, preferably the window seat is preferred rather than the center. Window seat is preferred, and they should focus on the straight objects while traveling. And they should avoid empty stomach also, because sometimes empty stomach will cause a reflux and will cause vomiting. So they should avoid empty stomach, and preferably in the window seat. And for children with jet lag, we have to plan our travel during the sleep hours of the day, in the midnight or late night or early morning. So we have to travel so that the jet lag can be prevented. For children with air pressure changes, we have to ask the child to chew or eat something during the takeoff and landing time.
Why does the ear start to hurt for a child? And the children tend to hold their ear and they cry a lot. The ear pain is unbearable. Why does that happen? Is it only in children or also in adults?
So mostly it will be in children, because their eustachian tube is not it's not vertical, it's something horizontal, so that it affects the children most commonly. So in that situation, we need to ask the child to chew or eat during the takeoff and the landing time. It's most commonly in children.
And what about infants? So, probably give them a feed at that time?
Especially, yes, exactly. The child cries during the travel. It could be due to the air pressure changes and the pain in the ear. So that time you try to feed the baby or give some paracetamol or colic drops if needed.
All right. Doctor, there has been also a constant ask, right? What comes first on the body? An insect repellent cream or a sunscreen? And can I put a sunscreen cream, say, on an infant child as well? Is that okay? Is it safe?
Yeah, absolutely, it's safe. So especially during the summer season, it's preferably use the sunscreens.
Right. And, also because the aircraft, say, if it's a short flight, it's understandable. But if it's a long flight, then a lot of parents tend to worry as well. How do you engage your children, say, during travel?
Yeah, this is very important. We need to carry a story books or a coloring books for the child, and you can bring some school supplies to the child to engage them. Avoid screen time during the travel and indulge in nature study.
I like how she's saying that, but she's looking at my face and I'm thinking, oh my gosh. Well, it is true, but how much can you keep them off the screens, doctor? And that is again another problem, not talking about infants. In fact, this is beyond the conversation. And because you're seated here, I have to ask you this, right? Um, as parents, when the child is young, you start making them watch cartoons. And one of the famous cartoons that I remember when my little one was growing was Cocomelon, correct? So Cocomelon became, the song in the house, and every tune that Cocomelon sang, my son was quite in tuned with that. But the problem was he was watching the characters, not focusing on his plate. And today he's about 7.5, 8, and he still is the same. Could you please help me break the ice, and how do I take away that iPad from him?
Yeah, like I would like to stress on this point. The parent should know before 2 years, we should not advise any screen time, like zero time. The screen time should be nil. After 2 years, we can engage them with except Cocomelon, we can give some educational videos or something they can productive videos we can show them other than the Cocomelon and some violent videos. So we can ask them to watch any creative videos like Rachel videos, so that they can engage and they can be a productive thing.
Doctor, these days, right? I mean, a lot of parents are also struggling with children who are not in the zone to speak. We have ADHD, speech delay, and suddenly all these conversations are coming to life. Is it because of the videos, the iPads, the televisions that the children are watching, or are there anything else as well that you can help us? Parents are struggling right now.
Exactly. But this is not the sole reason for speech delay or behavior problem, but it could be a main reason for that. So most of the children exposed to the screen in the early stages, like early 6 months, 10th month or 1 year or 18th month, they are more prone to develop speech delay, behavior problem, attention deficit problem, and memory, learning problem. So these children are more prone to get these problems.
Doctor, what would be your advice to parents, say parents to be? Is there anything that you'd like to tell us? Maybe, we are just getting into that whole phase of motherhood, very excited, but we don't really know what lies beyond that, right? How do you raise a child in 2026? Is there a book? Is there a rule book that you can help us with?
Yeah, we can update our knowledge with some parenting tips or parenting apps. We can because we can read some books regarding that. But I must tell that every parent should learn about the parenting and be responsible in developing these children.
Time and over again, also, I'm sure you would have, people coming to you saying we are traveling all the way from here, from Dubai, Sharjah, all the way towards Oman. But how do we keep our child on that seat without giving the iPad and ensuring the child is engaged for an 8-hour drive or even a longer drive? Do you have any specific tips of how to, kind of take my child in the car and travel with my child?
Yeah, you can give some, like as I said before, you can give some coloring books, interesting story books, and we can download some musics, audio books, so that they can enjoy. And you can buy a new toy for them for the travel. During the travel, you can surprise them with a new toy so that they can engage during the travel. And especially during the summer season, before starting the car travel, you should be aware of certain tips. So we should be turn on the car and keep the temperature below before letting the children inside, because severe heat will cause severe heat burns and heat exhaustion to the kids.
Right. Dr. Rupa rather is from NMC Healthcare, and they have opened the newest clinic in Muweilah, Sharjah. NMC Medical Center, Safari Mall, conveniently located on the first floor of Safari Mall, Muweilah, Sharjah. Congratulations, doctor.
Thank you, dear.
All right. So, doctor, when you have a lot of parents coming to you, right? I mean, beyond what we are discussing, what are those common questions that they ask you and that you feel, I wish I could tell everybody the answer?
Yeah, the parents should aware of the summer tips also, because during the summer they need to carry the child safely. They should ensure the adequate hydration during the summer, and they should avoid screen time during the summer breaks. And during travel, they should be aware of the family travel insurance also.
What is the family travel insurance?
Yeah, like those who are traveling with the family, like with the during the travel, they need to be aware of the insurance. Travel insurance is there, and they should be aware of that, and they should be taken that.
Right. When traveling with children, what food must I make sure that they have? Is it okay to give them flight food, or should I be carrying their food with us? Just because I want to make sure that my child is healthy and not eating anything that would cause them a tummy upset.
Yeah. Preferably, we should advise them to make favorite homemade snacks during the travel time. Because sometimes the flight foods will cause stomach upset to the child and will cause some gastric problem or loose stools or vomiting. So preferably take a homemade food which is favorite for them. And you should keep the snacks available all the time, because hunger makes the kid uncontrollable, and they will become inconsolable also sometimes.
Right.
So you should keep the snacks always available.
Doctor, is it okay to introduce sweets to my child at the age of 2, or you feel it's an absolute no-no? Well, I'm just grateful because my son is almost 8, but he doesn't really eat sweets. He doesn't like sweets. So I'm thankful on that. But is it okay? Is it okay to introduce chocolates and, all these gummies and everything sweet to the child, or we should not introduce?
For less than 1 year, we should not introduce sweets and salt foods. For more than 1 year, we can give sweet or salt foods, but in the restricted amount. There is a limit for that. So we need to restrict to that, because more sweets will cause more weight gain, and later on it will cause some diabetic or any obesity. So these kind of problems we may expect.
Doctor, what about these packed foods, these jars that you get onto the aisles in supermarkets? Is it safe to consume them? Because that is also written as baby food, right? I mean, you pick up those jars and it's easy. You open them and you feed your child. Is it safe? Is it not safe? I'm seeing your smile.
Yeah, absolutely. The packed foods are not at all safe for the kids. So fresh, homemade, prepared food is safe. The packed foods contain lot of preservatives and absolutely harmful to the kid only. So when it's taken for a long period of time, it will cause some gastric problems, and as I said before, weight gain, obesity. So these are the problems we can expect.
Including brands, I mean, there have been so many brands in the market, where you can make those porridge like Cerelac, and they would have several wheat and rice and sugar and this and that. And it was very tasty. I still remember. But most of us parents have prepared that food and given our kids. Why is that wrong?
Yeah, like as I said before, it is stored for a long period of time. It contains some preservatives, so it could be harmful to the kids. The freshly homemade preparations are always safe. So try to avoid packed foods to the kids, because sometimes it will contain some trans fats, so it will be harmful to the kids and will derange the cholesterol levels and leads to weight gain, obesity, as I said.
Very interesting, Doctor. If I am to travel with my child today, if you can quickly sum up whatever we've been speaking on tips of how to travel with my child, be it air, be it sea, or be it land, what will your word of advice be?
Yeah, as a whole, I would like to advise to the parents, while traveling with the kids, travel the favorite snacks, travel with the plenty of home boiled cooled water with you, and essential medications we need to carry, and you should be aware of the travel insurance, and the parents should know about the special vaccines we need to take in before travel, and they should be aware about the basic idea of how to manage the jet lags and motion sickness and heart pressure changes, and they should know how to take care of the infant while traveling.
Very interesting, Doctor. Thank you for taking time out and having this chat with us. More power to you. For the ones that are just about tuning in, well, yes, we were in conversation with Dr. Rupa, and she is from a newly opened clinic. NMC Healthcare has opened its newest clinic in Muweilah, Sharjah, NMC Medical Center, Safari Mall, conveniently located on the first floor of Safari Mall, Muweilah, Sharjah. Make sure that you're going down there, and if you see Dr. Rupa, say a hi. We heard you live on the radio. Dr. Rupa, you did fabulous on air.
Thank you. Thank you for giving this excellent opportunity to me. Thank you.
Well, you're more than welcome, and we want to see you more often coming to the studio so that we can talk a little bit more.
Yeah. Exactly. Thank you.
Well, we'll continue more conversations right here on Talk 100. Quite literally, stay tuned. I'll be back in the next hour to share more news. A very good morning.